Very good evening, students, and please confirm the audio video. Let me also check in my phone. Yeah, audio video looks good. You can post your queries later on also. In between also we'll take up regarding this topic. Sorry, little delay in this. The students are students who have got selected. First of all, congratulations. You have been called up upon for the interview. Dr. Rafe Sahej, you have time. If I am sure you are the same person, try avoiding such thing. We will be doing it for your batch as well. If you are the same person I am addressing to, I think your need is still yet to come. Okay, but yes, you can attend if you are pretty sorted in other aspects, right? So good evening. um, Congratulations to all those who have been called for the interview in coming days. You all have been preparing. We have been talking, like many students called up regarding this. So we'll start and we'll take up the each and every aspect. Why I'm able to discuss this is I needed time actually when students started messaging and calling regarding this. I have my batchmate, one very good friend who is a lieutenant colonel in the army, another batchmate who is another lieutenant colonel in the army, another batchmate who is wing commander in Air Force. Many students in last 16 years, you can say 15 or 16 years, who are in army in different cadres. Okay, plus I took feedback from the last year students, now captain in army, what about their experience. Also last to last year, two batches I digged up, and taking into account all the aspects, we'll be discussing this. Now, Army Dental Corp interview is divided into a personal interview and a medical checkup. Now, this is the area which is very rigid for last 2 to 3 years. Earlier, like when my batchmates were selected and my other students and friends got selected, the medical used to be a little, you can say, it was important. It was done meticulously, the medical checkups, but now it is done very rigorously. Even if you have the slightest of problems, like the commonest, I'll tell you the problem which they don't accept is knock knees. The problem very common. Okay, nobody is to be blamed. Either you have knock knees or you don't have knock knees, because that is a trouble in running. So if you are having some issue, like, then it is going to be a little difficult in clearing up the medical. And if it is okay, then this is one of the major hurdles. But that's where they don't stop. They go up to the detailed examination of your body overall from top to bottom, eyes especially. Okay, hematology and all, like the other aspects they will discuss. Any ailment you have they will discuss, but eyes and all. Then weight issues, if you are by chance underweight or overweight, and your interview goes very well, you are given 30 to 40 days to overcome that problem. Okay, basically they want to, even if you have some minor issues in health which can be corrected, some minor problems or say a wound or something, not to worry, it can be sorted off in 30 to 40 days, which they give you provided your interview goes very well and they really want you to be a part of the army organization, right? And that is where the catch comes. Then is PI, personal interview. Now, personal interview is a very, you can say, can go in different parameters. Firstly, try understand there is a panel of interviewing you. There won't be any one person or two person. There will be a panel, like 4, 5, 6 people, maybe 7 also at times, of different ranks and maybe different specialities, maybe medical officer as well. Yeah, Dr. Upasana 45 days, but earlier they used to give 40 days. That's an average. But students in the past have also done. I remember a guy lost I think 12 kgs or 16 kgs in 40 days. Okay, to get into, and he was selected. Okay, I know because he's a good friend of mine in the past. There is a panel, right? There is a panel. There is not, so interview can go anywhere you want. Okay, it depends on how you answer, what you answer. So first and the foremost, we'll talk about the curriculum which is relevant for the interview. One thing you have to remember, first thing is, all they will be asking you will be clinical. Very rarely or very remotely they will ask you any theoretical topic. Like for example, if we talk about perio, nobody is going to ask you anything about, say, what is width of attached gingiva in premolars and molars, what is the cytokeratin present in gingiva. Very basic hardcore theory they will not ask. Name the microorganism, classification, they will not ask you these. Very rare. Like if your viva you had a bad day, then only it will come. What they are more interested in is your clinical approach towards the cases, towards the scenarios, towards the problems, maybe mostly related to a dental OPD. You imagine yourself, you are selected in army and you are serving in army dental hospital or clinic, and you are the dental officer over there. OPD will come, patients will come, you will be given a segment of patients to be done every day, and patients will be coming maybe of that area, maybe from far of portion from that area. Now what kind of patients can come, your viva will go on that aspect. So firstly, your patient most likely will bring pain. Chief complaint. What chief complaint the patient will bring? Pain. Pain can be related to a tooth, that is related to caries or related to endodontics. Pain can be related to periodontal problem. Pain can be related to trauma, right? Pain can be related to any lesion. So you have to have thinking on these lines. So what you need to do is, if you ask me about what kind of questions they will ask you, they will ask you about Ellie's classification. That a caries comes, maybe they directly tell you class 3, class 4, class 5 or something, or they tell you the caries is approaching pulp. Now what will you do? Or caries has approached pulp, what will you do now? I hope you are getting this point, right? When we are talking about pain in relation to the tooth, the discussion will be on such parameters. Nobody is going to ask you what are the theories of caries, but what is the management of that caries is very much interested in. So what important you gain out of this is, you should be very thorough with the caries management in relation to conservative dentistry. Cons. Right? Then see, now the viva can see, since it's a panel, viva can jump from the questions you answer. Say myself and you, we both are discussing a case of deep carious lesion, and you talked about, say, doing composite or amalgam, whatever. Somebody, the moment you say composite, another panelist may ask you, how will you isolate? So they will ask you, how will you say, I'll use rubber dam. So the next level of questions can cross towards rubber dam. Now these questions are very, very subjective. If the interviewer person, the panelist, is very much well versed with rubber dam, definitely he or she will ask you. Definitely. But usually what happens is, you have to analyze, now go back to your times when you had given viva in third and final year postings. You also know to a certain extent that examiner has this much limited knowledge. An endodontist will not cross the barrier of asking you anything to everything related to endo. But yes, they will ask you relevant part. How do you check for endo vitality? How do you check with apex locators? What are the file systems you are aware of? Nobody is going to ask you to perform there, but they just want to know your basic clinical knowledge, maybe about little bit of bleaching, maybe about periapical lesions. How do you distinguish between a tooth with and without periodontal periapical problem. How you are going to do, what will be the radiographic evidence on that, what will be the clinical evidence on that, and so on. So these viva can go on and on in these directions. So you all have studied, ऐसा तो कुछ भी नहीं है जो आपने नहीं पढ़ा. So even if you revise your subjects, but this time not from the theoretical point of view, but from the clinical point of view, you will master it. Like if I talk about even you revise dental materials, the choice of materials in different cavities, how do you manage class 5, how do you manage class 3, what is layering technique in composite, how much time after amalgam you are not supposed to eat, and so on. These things will help them, and they are already there in your notes. Yes, nobody is going to ask you about casting and casting defects, but they will ask you about what is the choice of crown you might give in anteriors or posteriors, and so on. Implants. Another specialty they ask nowadays is a lot about implants. Lot about implants. And if you want to actually make sure that you know implants related to this part, just revise your lecture notes from DM, from perio, from prosto. It will be sorted. Whatever we have covered in those notes, it's already, you can say, going to solve all your problems related to interview. Okay, then periodontal, perio is asked, but perio is asked clinically, like gingivitis, periodontitis difference. How do you distinguish, how do you diagnose anag, or maybe treatment of anag, maybe treatment of aggressive, maybe treatment of gingival enlargement. Okay, what are drugs which cause gingival enlargement? Anything and everything which is related to clinical perio, maybe you can see it. Okay, it's not there in the book, but it's there in the OPD, it's there in the patient. Imagine a patient with periodontal problem can come to your clinic. Okay, what is the management of a grade 2 mobile teeth, grade 3? How do you check furcations? What are the instruments you know? Okay, to check furcations. What is the, you can say, how do you manage furcations? What is the treatment modality in relation to periodontal, you can say, abscess? What is the modality for clinical attachment loss? How do you measure clinical attachment loss? And so on. Right? Trauma from occlusion. Difference between traumatic occlusion, trauma from occlusion. What is the impact of smoking on PDL? Okay. These kind of questions are going to come. Definitely they are going to ask you. What is peri-implantitis? Okay. Again, you don't have to do by heart of definitions and all. Nobody, even you also know a person of, say, colonel, lieutenant colonel, or brigadier rank person is sitting in front of you. He is a periodontist. He also doesn't remember any definition. Dr. Aisha, whatever they are considering, that is the final decision, and that is in accordance with the Supreme Court ruling. Okay, I'm not a person to comment on that. So let's not discuss. You have to accept that, and if it is not acceptable, you can always file a plea against that. Okay. AIR rank range is not, it's like they usually call up to 1700 rank the call letter for. Coming on that, Dr. Upasna, abhi PDL is done. Trauma. Now trauma sunte hi, the moment the first thing comes in your mind is the branch called oral surgery. Now oral surgery is not only oral surgery, you have to club it with little part of general surgery as well. General surgery as well. Basically, most important part of your viva is medical emergency. Right from the patient going into syncope, how do you diagnose syncope, how do you manage syncope, how do you treat syncope, to anaphylaxis, to drugs, to anesthesia, to LA, to GA, to airway management, cricothyroidotomy, tracheostomy, laryngeal mask airway, anything and everything is important. Rather, I would say OS and general surgery part is the most asked in the viva. See, if you go back in time, army used to have only these 4 specialties as MDS, okay, in AFMC and RNR Hospital, Delhi. सालों से सिर्फ 4 थी. Now they recognize endo also. But for 20, 30, 40 years, army institution were not recognizing endo as a specialty in their institution. Simple reason, they used to believe BDS को endo तो आना ही चाहिए. But later on, last 5 years, they have incorporated endodontics also. So if anybody's senior is sitting, he or she will always be from these 4 branches. So these 4 becomes the ultimate Viva questions. Anything to everything related to the clinical aspect of OS, prosto, perio, ortho. Okay. Endo, yes, because endo thoda bahut sabko aata hai, and endo is the bread and butter of dentistry. Everybody, first and the last patient of OPD is usually endo only. Okay, पेन वाला ही पेशेंट होता है, तो पेन मैनेजमेंट इज ऑलवेज इम्पॉर्टेंट. एंडो तो कम्प्लीटली जस्ट रिवाइज योर नोट्स एंड इट विल बी डन. ओरल सर्जरी, जनरल सर्जरी, मेडिकल इमरजेंसी part is very important. They might ask you about extractions and the instruments, third molar extractions. Okay, very importantly about space infections. How do you diagnose third molar, second molar, first molar, upper canine? How, which space infection will be there? Very important related to the question in Viva is Ludwig's angina. How do you diagnose it? How do you treat it? Nobody is going to ask you to explain orthognathic surgery, pre-prosthetic surgery, but yes, an overview should be there. You should be aware of the basic terminologies. Then fracture. How do you diagnose? How do you treat? What are the signs and symptoms, especially of mandibular fracture? Right? Then along with this comes the radiology part. Radiographs, radiology. They can ask you, I told you specifically about this thing is, it means what? There will be no guy sitting from the branch called OMR, right? Person asking about radiology will be oral surgeon only. So they want the answers in relation to the views which they can see, condyle fracture, this fracture, that fracture, and so on. Even they can ask you on CBCT little bit info, but nobody is going to ask you about radiation physics. Hardcore radiology they will not ask you, because there is no OMR person sitting and interviewing you on that day, right? Instruments are important, drugs are important, anything related to oral surgery. Overall, exodontia is very important, LA is very important, exodontia is important, LA is important. Okay, they might ask you, have you assisted any third molar surgery, or have you performed any, or maybe have you performed any, how many extractions you have done. Then any major surgery, how does an OT look like, what are the protocols of sterilization and disinfection. Very important, especially after the COVID era. These topics have become the discussion of interest. Okay, so these, anything you think from the point of being an oral surgeon is important. It's not, nobody is going to ask you the bacteria involved in osteomyelitis, but yes, they can ask you what is HBO therapy. Okay, how do you manage osteomyelitis? They can ask you. Okay, so these are the things you have to take care of, right? Right. So this is in relation to oral surgery. In relation to OPATH, nowadays last 2 batches of army interview, they have been talking a lot about oral cancer. So you should be aware of the common cancers in relation to the oral cavity: squamous cell carcinoma, basal cell carcinoma, ameloblastic carcinoma, pleomorphic salivary gland tumors and carcinomas, TNM classification. Just having a fair idea about that. Okay, even in oral surgery, one favorite topic goes is gunshot injury, the management. Okay, because these are the small things army people are dealing with. Okay, most of the time they are dealing with complications, they are dealing with trauma. So complications are important. Emergency is important. Okay, they might give you a case like you injected PSA and you are extracting upper 6 or 7, you injected PSA, suddenly this area started getting blackish, bluish. What will you do now? The management of hematoma, hot and cold treatment and all that. Okay, so be prepared, over prepared I would say, and be confident in these answers. Be very sure. Never answer an interview, especially in an organization like army, with doubt. Sir, it can be, it should be, it must be. That should be your body language. Okay, the words you choose should be very, very authoritative. Like, yes, this is the thing I know, I have read, and I am telling you, and this is the fact, and this is supposed to be done. It cannot be, you cannot give them options of treatment. You have to give a definitive treatment. The options have to be, yeah, we have Dr. Anand Mishra. And if will it be sufficient, revise. Dr. Aisha, yes, revise your notes only, and everything is should be there. Yeah, good evening. I think Dr. Anand Mishra is the same. I am imagining a person who is doing OS, last year student, if I am not mistaken, 72 rank of last NEET, a student. So these are the things you have to be prepared with. Oral, this is the update. I got it from the last two batches who gave the interviews. There little bit discussion on cancer, right? Then is lesion. That is what the cancer I meant. Okay. Yeah, great. Welcome, Dr. Anand. Nice to see the bargain of legends in our online sessions. Okay. And ये तो part है this OS. Then is prosto. One observation in army, the top rankers, the top rank means the ranking in army. If you see the highest rank people in army, either they are prosto or they are OS. Okay, so that is where the prosto fits into. Prosto mein maximum viva usually goes into format of implants. Then they can even ask you in relation to CD, very less on RPD, CD, FPD. The things which are most commonly being done are asked more. CD mein they can ask you anything. Like they can ask you landmarks, they can ask you anything which is related to, imagine now you are a final year student who was making a complete denture. Just remember your prosto posting, how good or bad you were in that time, and what were the instructions being given to you, how to take a primary impression, how to not take, make. Prosto people always says you make an impression, don't say take. Okay, making of primary, making of final impression, how to make a tray, special tray, border molding, JR, teeth selections, all the clinical steps. How do you do flasking? What are the areas where CD, problems in troubleshooting in CD? Okay, same for FPD. What are the finish lines? They can ask you in relation to anterior crowns, posterior crowns, how much cutting you will do, how much tooth preparation, some Antes law. They can ask you like anything randomly, like if I have a missing central, what abutments you will choose, right? They can ask you about pyre abutment. Basic concepts of these are important. Remember, Viva starts with basics and it depends on you whether you want it to rotate around basics or you want the examiner to go up to the depth. If you keep on answering questions, okay, there are always two situations in Viva or interview. One is you keep on answering. Say I am asking you question, you are answering. I started with basic and you are answering. That will prompt me to go to the higher level. If you fumble up in my 10th level question or 9th level or 11th level question of basics, I started with one very basic question, you answered, then another, you keep on answering. Then I'll try to ask you certain thing, that is my ego, mostly the ego of the examiners, will keep on asking you till the time you stop answering, and that you don't have to worry. If they are dragging one topic to the highest level, it means you have already impressed that examiner. Okay. Nobody is judging you at this level, but yes, they definitely want to judge you at the basic level. Okay, they always want to judge you. Can you just give me 2 minutes? I'm getting another call from a captain in army who got selected to, I won't show his name, so I'll just take the call and take 2 minutes update. By the time you can post your query, I'll just mute it. Sorry guys, and I hope you will excuse me for this. It was an interesting call, again from one of our student who got selected last year. See, dress code has to be formals. Okay, I think they are mentioning on their letter also. चलो let's अभी तक तो जो पढ़ा I'll tell you the update. I got it on the call right now. Okay, first thing important is nowadays they are asking a lot about GK. I was coming on that part, but let us chalo do it right now only. GK mein they can ask GK is GK, so start reading newspapers, especially of current dates. Nobody is going to ask you what happened in 1947 and 1992 or something, right? They can maybe ask you about a little bit of COVID years and all, but GK means latest. Then general awareness you have to be aware of, like what is happening in the country, what is happening in maybe the recent Ayodhya issue. Elections are coming up, Lok Sabha elections. When are the elections coming up? Okay, maybe worst case scenario, the name of president, vice president, speaker of Lok Sabha and all, but not of that level GK. They will ask you smart GK, okay, which is very latest and very recent. Okay, very interesting type of a GK they will ask you. One interesting, he told me last year one student was asked what is the difference between MasterCard and Visa card, and his Viva kept on going for 5 to 10 minutes on these credit cards only. Okay, right? So this is a very strange, but yes, this has happened. Another student was asked a lot about banking. What are the national banks? What are the private banks? Okay, which bank went under bankruptcy? Okay, recently the answer was Yes Bank. Who took over Yes Bank? Like 49% share of Yes Bank was taken up by SBI when they announced 2 years back bankruptcy. Okay, so such questions were there as well. Such questions were there as well. Then he told me nowadays the panel will be of 9 people. Okay, not 4, 5, 7. It is around 9 people. One person will always be a psychiatrist, and he will definitely ask you one question related to psychology or psychiatric evaluation. You can say he will try to judge on that. So be stable, be calm and composed. Then definitely the departments of dentistry, there will be no pedo. People who are telling you no need of going into pedo part. Cons endo will be there. Ortho guy will be definitely there, I told you. And most of the time ortho guy will be there with spotters, and they will ask you to spot 2. He will be sitting next to you, he or she, maybe very close to the candidate with the spotters, and he will give you in hand. Okay. So no pedo. Perio will be there. Perio will be there. OS will be definitely there. Even one person will be general surgeon. One person will be general surgeon, and he will definitely ask you something about general surgery. Say maybe questions on shock. Again, most of the time he will be ask you related to emergency or principles of general surgery. Okay. Principles of general surgery. Emergency, general surgery, immediate shock, burns, okay, maybe ulcer, very grossly, not going into very deep. Nobody's like, again, recollect what you had seen the cases. He might ask you what kind of cases you saw in third BDS when you had ward posting. So you can say hernia, hydrocele. Then the question might be, how do you used to diagnose hernia? How do you used to examine a patient with hydrocele, or maybe diabetic foot or thyroid cases? Okay, these kind of things can prompt. So it's better, I would say, in such cases, if somebody has already asked you openly, say I am asking you a question, what kind of cases you saw in third BDS or general surgery wards. Now you don't have to say 100% truth in this time. Be very smart. Okay, tell about the cases. Don't say you have seen even breast cancer. Don't boast that time. Then your viva will go into that direction, and you might not be very well versed with that topic. So just speak out the topics. उतना ही बोलो जितना आप उसको concisely manage कर पाओ. Okay, speak out only the diseases which you are very sure of. Right? You have to play smart in this. It is an opportunity not to spoil, but to gain out of it. If somebody asks you what you are good at, yes, you have to say something what you are good at. Then yes, last 2 years mein there one guy of public health was also there. One guy of public health. Now public health means the same. Nobody is going to ask you what is chi-square test and all that, but the basic about sampling, basic about fluorides, basic about some programs by the government schemes or something. Okay, what is mainly like on these aspects which can be asked in the viva. Now remember your final year PhD viva. Prosto is definitely there. We were discussing that. Then one guy is a committee head. okay, maybe of a very top rank like major general rank or something, they will ask you about current affairs and all. Okay, but yes, what interestingly this guy told me is they never usually they don't ask about army. Nobody is going to ask you about the ranks in the army, tell in the sequence and all, but still I would say you should be prepared of it. You should know basic about army. Okay, when was Indian Army formed? Just go to the army website and basic data. What are the ranks? Every doctor, medical and dental have to undergo one training called MOBC, which is there in Lucknow. Okay, for 2 months or 3 months the training is there. That is the basic army training, artillery training, fitness training and all that. MOBC stands for Medical Officers Basic Course. Okay, so this is basic things you should be aware of about army. Don't go into reading too much about army, because that's what he said last 2 years में तो पूछा नहीं है किसी को. But yes, basics should be very clear. Now one question which I feel they will be asking you, maybe I asked him to rush up because I was middle of this session. I don't want to waste your time. So I'll call him up again. Any update, I'll post it in the comments of this video, or we can have one more session later on. One question is, why you want to join army? Okay. Another question of this is, why you think you are the best candidate for ADC? Why not your friend who came before you or after you? So be prepared for this. It should be a well structured answer as far as I believe, but it should not be a rectification answers. Okay, all those who have watched movie Donkey, it should not be a rectification answer. It should not look like you have already prepared this, but it should come up with some spontaneity. It should come up with some say thought here and there. Just look and tell them. Never say you want to settle down, that's why you want to go to army. Okay, though maybe it's your basic answer. If you have some army background reference, that adds value to your answer and your overall profile. Otherwise, always childhood dream. I am fascinated with the organization. I want to serve my country. It always fascinates me. Okay, don't repeat the words which I am doing. And I like the discipline. I like the men in uniform. Anything, it should be like maybe sounding little bit silly also. But don't talk about money. Don't talk about settlement. Don't talk about your retirement plan or something. Okay, and serving, to basically I love my country, I can die for. Don't use such words. Yes, everybody loves their country, everybody loves India. Okay, but they will ask you, then the question will be, you know how good or bad the situation is. You will be transferred every 2 years, your married life will be spoiled and all that. So at that time you can always tell that yes, I am already well versed with it. I have my seniors, I have my friends who are already there in the organization, so I know how the things go by. Okay, so it should be coming with a very confidence reply. Dress code for interview, any external affairs, defense related, not much. Dr. Upasana, can you practice? See, it's not IAS or something which can be practiced. So I'm telling you, just think on these lines and prepare. I have to apply for army. Not will MDS counseling and army section. No, Dr. Aisha. Army interviews come once you get a rank in NEET, and then they call you via letter. Okay. So these are the things. I think we have covered all the subjects part. Endoperio. Okay. Then yes, show confidence in the interview. Dress formally or as mentioned as the dress code. Hair should be nicely done for girls. Boys should be trimmed up. Okay. Tattoos are a big no in army. Right? It's a big no. I remember one of my friend who is a lieutenant colonel. He's an oral surgeon. So basically he had a big tattoo and he had to remove it once he joined army. So if you have a tattoo which is very much visible, you can always tell I'll get it removed ASAP. Okay. Dr. ABC, it's better not to have DMFT index. Okay, very bad, in a bad figure. If you know you have cavities, get it filled tomorrow or day after, before the interview. Okay. See, one thing which I know from the recent last 2-3 batches is they want to see how good or bad you are in a shape of commitment to the defense services. If you want, I can discuss one case which is not very like, few candidates were rejected on the basis of medical, few were put on hold, right? And they were asked to get some surgeries done, right? So I know one guy who was told to got one surgery done of a private part, right? So usually what happens is, first they will see your reaction, whether you are comfortable or not, and most of the time the candidate will not get it done. But this guy underwent that surgery. I know because I only referred him to a general surgeon for that, and that shows the level of commitment. Like he said in the interview only that he will get it sorted. Okay, so they put that candidate in the hold. They give when the result will come now, result will come in with a waiting list, and that's where the challenge comes. Like, if suppose your name is not in the top order and you are in the waiting list, many in the top order will fumble up in such parameters. So Dr. ABC, my suggestion is, don't give them a chance to diagnose any problem. If your medical dental checkup says this is the problem, if suppose your dental checkup will show cavities, definitely they'll ask you to get it filled after that, or maybe you get it filled that time. Okay. So Dr. Sujay Singh, I'm not aware of, please see the eligible date in the army letter, right? Confidence has to be there. It should not look like overconfidence. Over smartness is never welcomed, right? If you don't know the answer, simply say, I'm sorry, sir, I have read this, but I don't know why I'm not able to recall today. Okay, but definitely I have read. So they might, you can say, don't end up falling in a trap, basically, by giving false, wrong answers and then trying to justify your wrong answers. Okay, and at times there might be a situation when you have answered correctly, but the examiner is not agreeing with you, the viva person, especially in the army. Okay, they have ego which is uncountable, like. Okay, so that time what you have to be very sure of is just say, sir, I have read, this is the latest edition which is saying this. I might be wrong, but yes, this is what we have read very recently, and just keep your mouth shut after that. Don't argue, basically. Okay, don't argue in an interview. There are always difference in appears. They put up a list, Dr. Upasana. List comes with top clear ranks and waiting names. With names, the list comes. That schedule, so you will get when is the medical examination and when is the interview. Medical examination happen on same day. When we get to Dr. Aisha, this you have to check with the schedule. I can't comment on that. Usually it's very neck to neck. Like they have a 1 week window. They have to finish off everything in that. Okay. And these are happening in Delhi only. You have to come. There is a North Block area where the army headquarters are there. So I think it is happening there only. I'll just find out these things. I'll note down the query. Okay. Pharma and all, nobody asks, but yes, they can definitely ask you drugs. Yeah, related to the medical part. Since there is going to be one medical officer, again, they can ask you anything relation to the patient walking in. The most commonest questions are related to hypertension, myocardial infarction, diabetes, asthma. Okay. And drugs, like basic drug. Viva can go into drugs. Like suppose you are talking about diabetes, they can ask you what are the latest drugs on diabetes, what are the types of insulin. Okay. what are the fasting sugars and what are the levels and anything related to that. MI, nobody is going to ask you markers, but yes, they can ask you what are the confirmatory tests for MI, right? Then what are the drugs given, streptokinase and all. Then hypertensive, what are patients को कौन सी drugs देते हैं, first line of drug कौन सी है, second कौन सी है, third कौन सी है, and so on, right? So these are there definitely. No, Dr. Upasana, no need to go into that. Well, of something like basic drugs which can be of importance in relation to a dental surgeon. Like you're sitting in a dental clinic, 90% of the time your patient is either going to be a diabetic or a hypertensive or both. And in India, yes, asthma also. Okay, so think on the lines of these drugs for these and you will be sorted. Plus little bit of say drugs which are related to dental treatments, like you can have coagulants, anticoagulants and all that can be done. Nothing much. No need to go antibiotics and all, and local anesthesia, general anesthesia. These nobody is going to ask you ANS drugs, CNS drugs and all that. NSAIDs can be asked. Okay. So okay, I think this will give you a pretty good idea what to study for next 7-10 days you have. I think interview starting after 7 to 10 days. You already have done something. I see, if you ask me, you are over prepared already. It's just you have to revise. Okay, think on the lines of Viva. Don't think on the lines of as an interview, right? So any query still you can post in the comments. This video will remain here. We are not going to unlist it. Just watch it. Post your comment here. I'll reply back here, or I'll conduct a session in a day or two again with the answers of your problems. Okay, no need to WhatsApp personally. Just type comments in the video link only. I'll take up as the questions and I'll contact the people who are better to answer. I was lucky enough, I would say, got that call. I can't name the person. He is already a captain in the army, and I really thank him for today's call. He saw my WhatsApp status and he called up. I had contacted him in the afternoon, and he was busy. Okay, chalo, thank you all. Anything? Dr. ABC, myopia to what level? I don't know. Myopia, I think 3.5 or 4 I think is allowed. Whatever is the range is allowed, you are there. But if you can get it corrected with phaco or laser surgeries after they tell you to do so, then only think on those lines. But if it is in the permissible range, say if you have 2.5 or 3, I think it is in the permissible range, so that should not be a problem. Don't end up taking such a decision right now. Okay, take it after the interview. Dr. Upasana, it's your call. Ideally both. Give time, say 1 hour for the interview, 1 or 2 hours for the interview, and as such you need to revise OS, prosto, endo and all that, right? No doctor, अभी तो जो call आया हुआ है ना, that is for last year NEET, right? So once your NEET is over, you will get a call somewhere in May, June, and your interview will be July, August or September this year. That is after NEET results. Right? Okay. Thank you. Bye. Take care. Any query, just post it in the comment section. I'll get up the answers and then get back to you. Usually up to 1700 rank, you get a call letter for an interview. Okay.